paid advertising should cost as little as possible. I mean, let's be honest, like we don't want to spend more than we need, right? It depends on the type of channels that you're leveraging. So for example, when we say paid advertising, we could be talking about omni-channel advertising, which is like everything, including CCTV and radio ads and all, whatever. Or we could be talking just about like Facebook and Instagram advertising, just specifically that narrow niche of advertising opportunity, or Google ads. When you're discussing how much should it cost, well, you want it to cost as little as possible. What you have to do is you have to analyze what are the channels that are going to be the most effective. And so when you usually kick off a paid advertising campaign, it usually takes like 2 or 3 months to really kind of finesse the campaign to say, oh, okay, we should spend less money here and put more money over here. Well, let's not run ads on this channel anymore. Google ads aren't working well. Paid advertising on Instagram is working really well. Well, maybe we should think about TikTok advertising. Let's get rid of our stock photography and use video advertising from moving forward. There's all sorts of different things you kind of start playing with. But what happens is over time, your cost drops per conversion so that you get higher click-through rates, higher visibility. You kind of like super zone in on refining the campaign, making sure that you're hitting the right market, your geographical area, and the right types of potential patients. You can't come into paid advertising with you can't limp into it. You kind of have to have at least a sizable budget to compete with the other practices in the area and to be able to get enough data to improve the campaign. So I usually recommend, regardless where you're at least $1,000 a month, if not a lot more than that. I think that's about the beginning. Anywhere, you probably need at least $1,000 a month. It is not uncommon for practices in larger, super competitive areas to be spending $5,000 to $10,000, maybe even $15,000 a month, especially if they're going after big case stuff like full arch. So you want to look for a budget that's probably, if you want to test out, if you've never done it before and you were just getting started, maybe $1,000 to $2,000 is probably a decent budget. But what you should expect to see is over the course of the first few months that you're actually getting higher conversions on that investment and that you're improving your conversion rates and so forth.